Colorado. Everybody jump over from Instagram to Facebook Live. I'm doing a lecture today. Welcome. This is Dr. Magarelli, CNY Fertility, Colorado. And I'm going to be doing a lecture today on natural cycle frozen embryo transfer. So all you lovely people who are on Instagram, jump over to Facebook Live or YouTube Live, and you'll be able to see the lecture. And then I'll jump back on Instagram in about 25 minutes. But all you wonderful people on Instagram, jump over to Facebook Live. I'm going to be doing a lecture on natural cycle frozen embryo transfers. So it's going to be interesting. Welcome, Karen, on Facebook and YouTube Live, CNY Fertility Facebook page or YouTube. All you wonderful people on Instagram, jump over to Facebook Live and YouTube Live. We're going to do a lecture today on natural cycle IVF. I'm Dr. Magarelli, CNY Fertility, Colorado. Hello, everybody. All you lovely people who are on Instagram, jump over, jump over to Facebook Live and YouTube Live. I'm going to be doing a talk on natural cycle frozen embryo transfer. Hi, Karen. Hi, Claudia. Hi, Letitia. All you wonderful people on Instagram, jump over to Facebook Live. I'm going to do a talk. You'll see me over there at Facebook Live, YouTube Live. We're going to be doing a talk today on natural cycle IVF. Pretty interesting, pretty fun. I learned a lot. Hello, Amanda on Facebook Live. All you lovely people on Instagram, jump over to Facebook Live or YouTube Live. This is Dr. Magarelli. Hi, Brandy Pruitt-Russo. Claudia, hello. Letitia, Karen, hi, guys. Brandy, I said hi already. So I'll put up the bigger picture of what's going on here. We're going to be doing a talk on natural cycle IVF. Natural cycle frozen embryo transfer. So all you lovely folks on Instagram, please jump over to Facebook Live. We're going to be doing a talk on natural cycle frozen embryo transfers. Hello, Angela. Good to see you. Hi, guys on Facebook Live and YouTube Live. I'm going to be doing a talk, as you see, on natural cycle IVF. I'll make it a little even bigger for you so you guys can see that. So, Angelica, I'll see you on Monday for frozen embryo transfer. You're going to be doing Dr. Fink, I think, on Monday. I'm pretty sure. What is your YouTube page? I don't know. I think it's CNY YouTube. I don't know how it goes. Anyone can help her, please? What is the name of the YouTube page she goes to? Because we are a Facebook page live and we have a YouTube page live. I don't know how to get to the YouTube page, but I'm sure if you go to YouTube and type in CNY Fertility, you'll find us there. But we're also on Facebook Live. Thank you, all you people on Instagram. I'm located in Colorado Springs. I'm Dr. Magarelli, CNY Fertility, Colorado. Today, we're going to talk about natural cycle frozen embryo transfers. I get a lot of people asking me about that, and quite frankly, I wasn't that sure of the literature about it, so we're going to explore it together. So all you folks that are on Instagram, are we on live? Are we on live now? Yes, Annette. We are live now. Yeah, I can see you, Annette. Yes, are we on live now? Yes, we are on live now. So all you lovely people on Instagram, if you'll jump over to Facebook Live, that's where I'm doing, or YouTube Live, that's where I'm doing the discussion today on natural cycle frozen embryo transfers. And after that, I'll discuss questions and answers. Hello from Orlando, Monica. Nice to see you. Annette. Lawrenson7829, jump over to Facebook Live or YouTube Live. Shaniqua J08, Facebook Live, or that's where I'm at. I'm going to be doing a talk on natural cycle IVF. I'll get started here in about a minute. I'm Dr. Magarelli, CNY Fertility, Colorado. Every other week, I'll do a lecture. And between every other week, I'll do a question and answer. At the end of this lecture, we'll do a question and answer. But the main thing is, if you guys want to see the slides, come on over to either Facebook Live or YouTube Live. I don't know how to join a live on Facebook. I think you just go to the CNY Fertility page on Facebook, and I will be live. If anyone can help her on how she needs to do that, that would be super. This is Catherine Panzini. Or you could hear me. I usually will describe what I see on the slides here, but it's so much more fun if you jump over to Facebook Live and see what's going on. Coming from Nashville, Tennessee, Karen. Well, guess what, Karen? Tomorrow I'll be in Chattanooga, Tennessee. So how fun is that? Don't know anything about it. I hope it's fun. Natalie Page. Facebook doesn't allow us to comment on videos without our friends seeing the comments. Well, I think that's good. I don't know. I don't know how that works. So I don't know. You can ask a question on the Instagram side, but you can watch it on the Facebook side. Again, folks, do the best you can. Jump over to a Facebook or YouTube. And that's interesting. I didn't know that if you comment on Facebook, but you can comment, by the way, your comments. As soon as I'm done my lecture, I'm going to come back to Instagram, so you'll be able to ask me questions. Well, it looks like most of the folks are over on the Facebook Live or YouTube Live side, so thank you. So let's get started. We're going to be talking about natural cycle IVF. So let's find out what that is, okay? All righty. So let's talk about what we're talking about, which is frozen embryo transfers. We're going to be talking about frozen embryo transfers and how to optimize, of course, for folks to achieve pregnancy. So the goal of a frozen embryo transfer is to create an optimal endometrial, that's the lining of the uterus environment, for endometrial receptivity, and these should be scheduled to match the state of the embryo development. So there's two classic ways we do frozen embryo transfers. Medicated, some people call it artificial. I think it's medicated. You don't need to ovulate. We control the estrogen. We control the progesterone. And all of this stuff comes from outside. Natural cycles, we actually use your own body's ovulation. Hey, Vanessa, thank you. Telling everybody to join CNY Fertility member group. Also, Vanessa, why don't you tell everybody on Instagram how to get to the Facebook Live and the YouTube Live section. So jump onto Instagram, Vanessa, and see if you can get everybody, put out some instructions on how to do the Facebook Live or the YouTube Live. So why a medicated cycle? Why do we want to medicate it? Well, we have a lower cancellation rate, so we can control it, and greater flexibility for scheduling. So there's an advantage. Why a natural cycle? Well, it's usually lower cost. You're using your body's own natural estrogen, and it reduces the use of the medication. So those are the positives. But is one better than the other for a frozen embryo transfer? And that was my question. So here is just the maternal blood flow and where the hormones come from to help the embryo grow. So during the first 10 weeks of gestation, the corpus luteum, you'll see here, is the source of all of the progestin that we need to carry a pregnancy. And then after that, as you can see, starting at about 11th week, the placenta takes over, and it takes for the rest of the pregnancy until term. That's where the hormones come. So initially it starts with the corpus luteum. This is natural. This is a natural cycle. And then later on, it's the placenta. So there was a huge study, and I know that sounds funny, but it was a huge study. Over 6,840 cycles were looked at retrospectively, and they were comparing those who did a medicated cycle with those who did a natural cycle. It was a study done in China. It was an Asian population, relatively homogeneous. The ages were 20 to 38, so kind of on the young side. They were all frozen embryo transfers, all blastocyst transfers, no donor sperm or oocyte patients, no PCOS, no recurrent miscarriage or recurrent implantation failure patients. So very young, very healthy group of patients. And what they found, well, how did they do it? So in their natural cycle, monitoring began days 8 through 12. They did LH testing, which is just to tell them when you were going to ovulate, and progesterone and estradiol testing. Some triggered with HCG, some were spontaneous trigger. After ovulation was confirmed, they started on oral progesterone, 10 milligrams up to 40 milligrams a day. And that's how they did it. Plain and simple, put the embryo in, let's see what happens. In a medicated cycle, we can't depend on the ovary to produce a follicle to produce estrogen. So they had to give oral estradiol, which is how we mostly do it. Progesterone was started, and then that was considered day 0 and transfer on the 5th day of the progesterone administration, or 6 days total, which is what we do. And the patients received oral and vaginal progestin. And when the endometrial thickness of 8 millimeter or greater, then they did the transfer, and then they did luteal support for 12 weeks. Pretty much what we do. So what did they find? And a lot of little numbers here in the corner, which I'm not asking you to read. I'll read them out. They found that on average, the natural cycle folks, the thickness of the endometrium was significantly, from 1 versus 0.9 in terms of the endometrial thickness, or 10 millimeters, basically, or 9 millimeters in the artificial cycle. So they found that there was a difference in age, BMI, regular menstruation in the studies, but because the study was so great, numerically, there really wasn't much of a difference. So for example, in the natural cycle patients, they were 30.4 years of age, and on average, and in the artificial cycle, they were 30.1. So as you can imagine, 2.2 years of age difference is not going to make a hill of a beans difference. So there really wasn't much of a difference. And of course, their BMI was very low, not very low, it was 22 versus 0.8 versus 23.7. So about the same. So what did they find? They found that the clinical pregnancy and live birth were remarkably higher in the natural versus medicated cycles. So 50% of the natural cycle folks got a delivery, and 40% in the artificial. That's a difference of almost 10%. In terms of clinical pregnancies, 62% or 63%. I see I put 53, it was 63% were pregnant in the natural cycle, and about 58% in artificial. So in that case, using the natural ovulation and using the natural estrogen from the follicle and using the progesterone from an ovulated follicle, and then in addition some supplements, seem to produce a better outcome for these patients. 20 to 38 years of age, no major medical issues. So in this case, big study, natural cycle IVF might be a good alternative, or actually a good choice for folks. Remembering, though, that it does have a negative effect, and that is it's not as flexible in terms of when you get your transfers. If it ends up on a Sunday and we don't work on a Sunday, then you may miss that cycle. But it was very interesting. Then I went around and looked at some other studies looking at natural cycle versus medicated. And what they found was that in those cycles where hormone was used to prepare for transfer, they again found a decreased pregnancy rate in comparison to a natural cycle. Now, the difference wasn't as dramatic initially. The pregnancy rate was in natural cycles was about 36%, so a little bit lower, but it was only 23%. And this is a 2007 study. And that, by the way, at that time was considered a great result. They found that there was, again, with the unmedicated or natural cycle up until the point of ovulation and progesterone, in other words, not using estrogen and using the corpus luteum, had an advantage. Again, another paper, this was a natural cycle frozen thaw cycle. Women with regular menstrual cycles increased the live birth rate compared with hormone replacement. Natural cycles had a higher chance of live birth than hormone replacement cycles for endometrial preparation in young women with regular menstrual cycles. So again, live birth rate, 62% in those who did a natural cycle and 55% in those who did a hormone replacement. These are excellent results. And these, by the way, in that previous study, it was a cleavage stage embryos. These are all blastocyst stage embryos. Another study looked at natural cycle implantation rates. This is whether or not the embryo you put in will implant, and is there a difference if you use a natural cycle versus a hormone replacement. And again, our results suggest that natural cycle endometrial preparation by ultrasound increased implantation rate, especially when transferring blastocysts. So much to my surprise, honestly, because this is a little bit out of my wheelhouse, meaning I was brought up in the era of medicated control everything. There may be a place for some patients who will get an advantage in doing a natural cycle IVF versus a medicated one. They'll save money. They'll use your own body's progesterone factory, which is the Corpus Luteum. And as you'll see, there may be some magical stuff from the Corpus Luteum. So this again was another study looking at ovulatory-based frozen embryo transfer, which means natural cycles may achieve higher pregnancy rates in the general population, and in this case, among women with PCOS. So the PCOS, aromatase, a better pregnancy rate was found after ovulatory cycle frozen embryo transfer. In ovulatory cycles, the outcome of letrozole-induced and non-induced cycles were comparable, which means, let's say you have PCOS and you want to do a natural cycle and you don't ovulate, well, you can use letrozole to stimulate the growth of the major dominant follicle. You can trigger the follicle, then you can get an ovulation and then start into your embryo transfer cycle. So in all of the other studies, they weren't looking at PCOS patients or anovulatory patients, but in this study, which is 2021. I mean, this is like yesterday. They found that there was an advantage to using a ovulation-based cycle preparation. Now, this is much more complicated in the sense that it depends on your body doing what it's supposed to do. So you have to understand it may mean that you don't have the control over the cycle like you'd like to have, and you may have to move your cycle to another month. All you folks who are on Instagram now, joining just now, jump over to Facebook Live. I'm doing a lecture, okay? Should natural cycles use progesterone? Because if some folks say, well, I want a natural cycle and I don't want to use any drugs. So all you folks on Instagram, please jump over to Facebook Live or YouTube Live and you'll see me there. Vanessa, as I asked, if you could send instructions to the Instagram side of things and tell them how to get onto Facebook, I would greatly appreciate it. This is Vanessa Rodriguez. So, should natural cycle frozen embryo transfers use progesterone? And the answer is absolutely. So, when we're talking about a natural cycle, we're not talking about an unmedicated cycle. We're saying natural from the standpoint of creating a corpus luteum. So, we're using the body to create a corpus luteum, which is an ovulated follicle, and then we're adding progesterone just to ensure and improve the outcome in terms of live birth. So what they found was that by adding the progesterone, they found a higher pregnancy rate. The odds of getting pregnant were significantly higher in these studies in which they added progesterone to the natural cycle. So we always add progesterone to our natural cycles. So don't think of natural meaning no medicine. Think of natural meaning we're going to get you to ovulate. We're going to use that estrogen from the growing follicle. So we're not going to give you estrogen. The timing, unfortunately, is really based on your body. So there's some inflexibility there. And but if you can ovulate and you do ovulate regularly, or we can get you to ovulate and then do a frozen embryo transfer, for some folks, that would be advantageous. That's just the data seems to suggest. Can we improve natural cycle frozen embryo transfers? What they looked at was, are there ways for us, they would look at the different protocols, and it turned out there was no particular advantage of one protocol over another in terms of what types of progesterone we used, how we used it, or right after ovulation, a couple of days later. So you're not because you're getting your progesterone from the corpus luteum, you are much more flexible in this sense that you can start your progesterone either 1, 2, or 3 days or 4 days later, and that's called modified luteal support, and you'll still have the same equivalent outcomes. So that makes it comfortable for us and those who are treating you, because then it gives us a little bit less worry that they're progesterone deficient because the corpus luteum, the very fact that you ovulated and it's a natural thing, provides adequate progesterone for those first 4 or 5 days. And that's just looking at the data there. But early or late, it doesn't matter. Now, is there a benefit for using your body's natural progestin? Is there a benefit, the corpus luteum? Well, it turns out there's some physiologic secretions from the corpus luteum that are associated with better pregnancy outcomes, less pregnancy-induced hypertension, less eclampsia. So it turns out relaxin and VEGF, which are 2 hormones produced by the corpus luteum, actually can help down the road in the pregnancy itself. So what they found was that you had the medicated frozen embryo transfer. These are ones that are not using a corpus luteum, had increased rates of hypertension and preeclampsia, whereas those who did use the body's own ovulation or natural modified frozen embryo transfer did not have this as many folks with hypertension and preeclampsia. So in other words, it may be protective to do a natural cycle IVF, which again, surprised the hell out of me. But again, that's what science is about. That's why I love science, is that you're always here to learn something new. And so it seems that it can be helpful. So what are the takeaways? And I know you folks are being very patient with me, and I appreciate it. The takeaways from what natural cycle frozen embryo transfers can do for frozen embryo transfers in patients without PCOS or hyperstimulating, that's my guess, is if you use a medicated cycle, you have a lower cancellation rate and greater flexibility for scheduling, okay? No questions this week, just wanted to thank you. You're so welcome. Why natural cycle? Well, it's lower cost, reduced use of medications. There is some data to support its use in both cleavage stage embryos, day 3 embryos, as well as blastocysts. Natural cycle, you can start your progesterone day of confirmation. Yes, it is when you confirm that you're ovulated, or a few days later, it still works fine. I didn't mention this, but the HCG boosters didn't, in some studies, show any advantage in natural cycles as long as you had adequate progesterone. And again, HCG boosters were used way back when we didn't know about progesterone. And the natural corpus luteum may play a role in the creation of fewer complications of pregnancy, and is associated with assisted reproductive technologies like hypertension and preeclampsia. So, lots of interesting stuff. I learned something new. I'm really happy to hear that we can safely and effectively use progesterone from a corpus luteum to set you up for a good outcome with frozen embryo transfers. You shouldn't feel intimidated if you do a natural cycle. You do lose some flexibility. You can have a cycle canceled. You do save some money with these natural cycles, so it is definitely has the pros and cons. But again, something new, something to think about, something to ask questions about. Okay, so now, all you wonderful folks on Instagram and Facebook and YouTube, I'm going to take a sip of water here, or a little drink of soda here, and then we can start asking the questions. I hope that was helpful. All right. You're welcome, Karen. Jozo and Morgan Lawyer, hello. Brandy's happy. Good, Brandy. Glad you're happy. Amanda, if you prep with Lupron or Orilissa, can you do a natural cycle? If you prep with Lupron, yeah. Well, you have to be able to ovulate. That's the key, Amanda. You have to ovulate on your own after you're off the medicines. And remember, Lupron and Orilissa will keep you from ovulating. Infertile doctor joined. Well, that's good. I am too. Alicia RM2020, hello. Other questions, guys. I'm open for questions. How long should I wait for a cycle if I'm not regular anymore? Well, it's 28 days. That's it. If you don't get a cycle within 28 days, contact the team and the team will help you start your cycle. Hello, folks. Welcome. That was Hope Lanning. Elena, how can I find out if I'm a good candidate for a natural cycle? Do you have regular menstrual cycles? Do you know when you ovulate? That's how you know. How can I find out if I'm a good candidate? Okay, Audrey, I had my baseline Friday and my progesterone was 2.1. Cycle day 3, I was instructed to start meds, but I know it's a little high. What can cause higher progesterone at baseline? Just the timing. If you waited 2 more days, you probably would be fine. Hi, Dr. Mag. I did a transfer April 28th and 5 days FET. How many months pregnant am I? By the way, when you do the day of your pregnancy test, if it's 4 weeks, it's approximately 28 days, then you're actually 4 weeks pregnant. You're not actually 4 weeks pregnant, but that's how it's calculated. With all docs at all facilities, would I be okay with this using a natural cycle? Yes, absolutely. The key, though, is not everybody knows the data. I tell you, I was resistant for at least the last 2 years just because I believe that I believed rather than had my past data seemed to support it, but the current data doesn't seem to support that medicated is better. So you got to change, you got to grow. When do I ask about HCG wash? Do you have that at the clinic? Yes. Or do I order? No. You bring, you order some HCG, and then we'll use it. So make sure you tell wherever you're going to one of our facilities. Make sure you tell the nurses there or that you want an HCG wash, because usually it's done. I'm in Colorado Springs. That's right. Oh yeah, I love all the staff in Colorado Springs. Thank you so much, Janet. I will tell you, they are a wonderful team. Shaney, 33, had my retrieval 11 days ago and no period so far. We did a double loop on trigger. Is this normal? 11 days ago. Yeah, give it another 3 or 4 days. You should have a period. Operation Baby, day 3 or day 5 embryos better for endometriosis patient? Neither. There's no particular treatment for endometriosis patients. It has to do with the embryo. Amanda Young says there's a calculator, which is a really good calculator. Your due date is at perinatology.com. Calculator is due date. Thank you, Amanda Young. Do you believe in ERAs? I believe in UFOs. I believe in miracles. I believe in miracles. Yeah, I know that's the song. I'm not a belief guy. I think there's a role for endometrial receptivity assays. Not as strong as I did before. I used to think they were like the cat's pajamas, but honestly, hey doc, what's an infertility doctor's asking me, hey doc, what's the best initial approach for unexplained infertility? Well, check sperm, check eggs, check uterus, check fallopian tubes, check hormones, make sure there's no sexually transmitted diseases, make sure the fallopian tubes are open. Unexplained infertility is rarely true. Rarely true. You usually find a problem there. Depending on their age, it could be simply age, and that's the cause. Do you see success in poor quality graded embryos all the time, Chelsea? For PCOS, do you suggest a medicated frozen embryo transfer? Absolutely, as well as for patients who are hyperstimulating. FET on Friday, day 3 embryo. Do you recommend HCG wash? I'm just scheduled for lipids at Colorado. If it's a frozen embryo transfer, I'm not sure. Oh yeah, the HCG wash. Yes, I do recommend that. It upregulates the receptor sites, is my understanding. So yeah. Are HCG boosters good for low AMH if my tubes are tied? HCG boosters, you have to understand, are there to improve a ovulatory cycle. That's it. So if you're not doing a natural cycle frozen embryo transfer or a natural cycle embryo transfer, fresh embryo transfer, I'm not sure it's useful. The biology doesn't make sense. When do you start HCG boosters around frozen embryo transfer? As I said, Ash Jawalt, I don't think that a frozen embryo transfer cycle will benefit from a booster. Our data today says it doesn't. So don't know. After 3 failed medicated transfer, how long do you recommend waiting for body to detox off medicine before trying natural transfers? There's no such thing as detox off medicines, Brianna Lynn 5. I don't know where you got that term. I've never heard that term, but there's no such thing. You just go to the next cycle. I had a baseline a couple of days ago. It shows estrogen-producing cysts. I've been told to use estrogen permethrin for 14 days. Usually I get over-suppressed if estrase is used. No. Estrase is not over-suppressed. Can I skip a cycle and proceed with the following cycle, Ramesh? Absolutely. Andrea, hi, Dr. Mag. Lupron twice a day. Gonal F, 150, Menopur 75. First ultrasound, 8 follicles, but second ultrasound showed 5 that are not synchronous. I'm 45. Any advice to improve my protocol? Yeah, see if they'll add growth hormone, serovital, and acupuncture. So you would recommend an HCG wash for a natural frozen embryo transfer cycle? I would not. No, it's for, the study says you don't have to. You could just use progesterone. You don't need the HCG boosters. You can use them, but there's not a lot of data or not a lot of science behind them. They were used many, many decades ago, 40 years ago. We used to use HCG boosters when we didn't know about progesterone. But now we know everything about progesterone. Could you do a non-medicated cycle for retrieval too? Nope. That means you want to throw away 1,000 eggs. That's Brandy. Every month you throw away 1,000 eggs, and the reason you give medication is to save them. Ashwald, doing a natural cycle FET with letrozole trigger, adding boosters and wondering when to start them. Well, the boosters are after you ovulate. I want to do my endometrial egg retrieval and transfer. What days are out of the office so I can make sure not to come then? When am I out of it? What days am I out of the office? Well, no, I just have a trip. Normally I'm in the office Monday, Tuesday, Wednesday, Thursday, Friday, and then once a month I'm in the office on Saturdays too. And then Dr. Fink is there all the other Saturdays and Monday, Tuesday. Oopsie, looks like I'm running out of power here. Oh no. Let me grab a plug here. If I have a plug. Let me quickly grab a plug, guys. I don't want to lose power here, guys. Hang on. Oh no. Where are we? There I am. All right, let me plug this in here. Hang on, everybody. Just hang on. Okay, I am back. Oopsie, that fell out. There we go. There we go. Sorry about that, folks. Got power. What is the opinion on 10 units of Lupron during the luteal phase to get better quality or more even follicles? I don't have an opinion on that. Let's see. Oh, yeah, I guess it could work. So, Erica, yeah, just talk to the team, but I'm pretty much there all the time. After testing, all testing normal besides 2% morphology, is there enough to explain infertility, or should I advocate for more testing prior to IVF, Amanda? No. 2% normal sperm. I don't care what age you are. IVF is your treatment of choice. I did a fresh transfer with you on days 5 to 7, and my beta is tomorrow. Praying for the best. Crystal, everybody send out good thoughts to Crystal, who's going to get her pregnancy test tomorrow. Eleanor, after using progesterone, I had a bad taste in my mouth. Is it normal? Don't know. I've not heard that. Do normal embryos made over 40 have the same success rate as younger normals? Yes, they do. After how many failed frozen embryo transfers do you recommend a laparoscopy? Usually 3, or if you have a history. Brandy, on my baseline at the local infertility doc, my AMH was 2.8. Nice. Left ovarian had 18 and right at 13. All blood work is great. Would you suggest mini IVF? No, the opposite. You do mini IVF when you don't have eggs. That's why you do mini, is to save money. Think of mini saves money, but it doesn't improve your pregnancy rates. It just saves you money, which is not what you want to do when you have a good egg reserve, you want to get as many eggs as possible. That's what you want to do. And I know I'm a broken record about that, but I really mean it. So I'm Dr. Magarelli, CNY Fertility, Colorado. I guess I have to say that now and again. Make sure you guys join our user groups. Vanessa out there will send that information. Rage against infertility. What are your thoughts on ovarian drilling during lap for PCOS? Never do that. Never do that. That causes chronic pelvic pain for the rest of your life. It is really, that's a way back when, 40 years ago. But today we know so much more about PCOS. Yeah, you don't want to do ovarian drilling. I just don't. My opinion, nah, don't do it. It's not going to be the advantage you think. And we got drugs that can do just as well, like Lupron to suppress you. So don't do it. No. Can levothyroxine for TSH impact estrogen levels? Some people talk about that. I noticed my estrogen has lowered the last 2 months I've been on it. Doesn't matter. It's still the right thing to do. Which supplements and IVF meds make us gain weight? What supplements and IVF meds make us gain weight? Gain weight? Nothing that I can think of. Finally got pregnant after struggling with secondary infertility after 3 years. Finally got pregnant with Femara and Metformin. Will I need to do this again for next time around? This is Gabichka. Probably. When do I start priming cycle protocol? 21 days of estrus, prometrium, follicular, or luteal phase? Yeah, the whole cycle before. So at the follicular phase started. Crystal says that prednisone, she's absolutely right. That's not an IVF medication, nor is it a supplement. It is an add-on, prednisone. That's not an IVF medication. It is not a supplement. Prednisone is a drug that some people use with limited data to support it. Yes, prednisone can cause weight gain because it causes fluid accumulation. It's a mineralocorticoid. So that's true, but that's not an IVF medication. It's just a supplement add-on that not many folks use. Hey, Doc, what's the treatment for recurrent pregnancy loss? I just found out I have low vitamin D and I have PCOS too. Well, the first, ensure you know why you're having losses, because it'd be chromosomal, it could be mechanical, it could be hormonal. First, find out what it is and then treat it. We've had 2 early losses a few days after starting Lovenox. Should I be thinning out my blood too much? Should I be skipping next FET? Well, if you've never, Ashwald, had a loss before, then I'm not sure you should use Lovenox. You can just not use it. Are you guys on Facebook Live or YouTube? I'm not getting any questions there. I just want to make sure you guys are live there, and I'm not seeing anything happening. Oh, hi, Karen. I'm in Tennessee. Need to make sure what clinic is closest to me. I have a phone call July 6th. I believe they will ask me where I want to go. So talk to the Global Travel Group. Here, thank you, Erica. Thanks for saying hi. Just want to make sure you guys are still alive here. As you know, today we did a talk on natural cycle frozen embryo transfers. It is recorded. So if you want to hear it again, we save them all. What is the success rate of frozen embryo transfer with a gestational carrier who has had 2 healthy? Well, it has to do with your eggs and your sperm. Nothing to do with the gestational carrier. So the success rate is based on your age. Hillary, I'm 41, just had 4th loss. Sorry. No PCOS, no endo, regular cycles, all test normal. What do I suggest? 4th loss. Well, a recurrent pregnancy loss workup. Look for the anti-cardiolipins, antiphospholipid antibodies. Make sure your thyroid's intact, your prolactin is intact. Nobody smokes in your house. The husband doesn't smoke. No. Make sure that you're avoiding excess sugars, doing acupuncture, serovital, growth hormone. Maybe you might want to do, well, it's a 4th loss. And it depends on when you lose it, but make sure you haven't missed anything. How long can I use Omnitrope for priming without a break? Probably, there's no need to break. You could do it at least 3 months. Do we have to use one genetic testing company that CNY uses, or can we choose one? I don't know why you would choose a different one than we're using, because quite frankly, it just makes it more complicated, and I'm not sure you're going to have any advantage. Unless there is an advantage, just talk to somebody. What is priming? That's simply, oh God, I hate these names. It just means that the cycle before you do your IVF, you add estrogen and growth hormone, which are just growth factors. And you may regulate it with progesterone. So it juices things up. Like it has to do with engines. You prime an engine with gasoline to get it to start it, and that's where it came from. So people think you can prime the ovary to give eggs out, but it's programmed to give eggs out like 1,000 of them every freaking month. So priming is interesting. What I use priming for, the way I use it, is to add estrogen means you're going to get neovascularization, which means you're going to get more egg growth. I use growth hormone because it's growth factors, which are associated with anything that grows fast. And once the follicle starts growing, it's growing fast. And sperm too. So you can use Serovital, which is a vitamin you can get at Costco or online. Get the regular one or original one. And I use it every day just because I'm old. Can I access donor eggs? Don't know what that means. One of my anticardiolipins came back indeterminate. Thoughts? Well, aspirin, Ashwalt, or Lovenox treats it. So if you're doing aspirin and Lovenox, you're fine. Zelda, does taking birth control past the recommended calendar schedule affect transfer in some way? Do we have to move everything one day up instead? Absolutely, Zelda. Make sure you tell them when you took it. How soon after you give birth can you have another frozen embryo transfer? Well, I would do it after 18 months, right? Because you want to breastfeed and you want to get your body back in shape. And then get pregnant again. Breolin 5, are there any supplements that should be stopped after transfer, such as Serovital? No. CoQ10? No. Vitamin D? No. DHEA, you should stop. What protocol do you recommend for getting mature and synchronous eggs in women over 40, estrase or Lupron priming? Any ideas? This is Andrea. If you got eggs, you could do a classic protocol with birth control lead-in for synchronization. If you don't have a lot of eggs, then you could do a mini. Do you recommend fresh or frozen for 40-year-olds? I tend to lean now towards fresh transfer, easier, better, I think. Alicia, I had an ERA and it came back as pre-receptive. Do you think that's a good reason for my failed implantation? Absolutely. That's how you use the ERA. That's exactly why you did and paid the good money for that ERA. Yes. All righty. I think it's water time. How can I get my testosterone level down with steroids like dexamethasone is one way to get it lowered. And that's part of a treatment. Ashwalt, I have PCOS. Should I stay on inositol during transfer? Absolutely. It is not for only egg quality, but it's also for managing your sugars. Alicia, thank God, got my second FET Friday. Yeah, so you're all set. Is there a higher chance of an embryo splitting with fresh or frozen embryos? Nope. Not at all. Not that I know of. I don't know of any data like that. Is a frozen embryo transfer better for PCOS patients? Yes, it is. Do you have any thoughts on recurrent implantation failure of PGS-tested embryos if you have already tried ERA receptiva and hysteroscopy is clear? Yeah, try acupuncture. That's what I would do. Growth hormone. And you said you've had hysteroscopy, ERA, receptiva. Now, you still can have endometriosis, but it's a good idea that you did the receptiva. See if there are some times you just need a gestational carrier. Is there a part of the recurrent pregnancy loss panel that I can do my insurance doesn't cover and was told it was really expensive? I don't know the answer to that, Hope. Why are you, Brandy, torn between a fresh and frozen embryo transfer? There's no difference. I'm not sure why you're torn. April, I'm 40, going to have DHE level checked Friday. What do you like to see the level? I do not. I don't check DHEA. It's not something I do. Would you recommend waiting to do my vaginal progesterone until after my HCG wash? It is in the morning? Sure, absolutely. Crazy, sassy, and I'm not going to say the word. I'm trying to use donor eggs with CNY. How can I access the genetic test results of the donors online? I do not know. just contact the donor team. What are the odds of all your fertilized eggs making it to blastocyst? 0. Adding Neupogen and boosters for FET on Monday. I mean, the chance of getting every embryo to blastocyst is extraordinarily low. It's very low. So you should expect, if you're in your 20s, to get about 60% to get there, in your 30s about 40%, and in your 40s about 10%. Is there any chance to do increased chance of twin pregnancies? Nope. Vanessa is asking us to join as a CNY fertility member in the group below. This is the Facebook group. Jump on it, babes, because that's really, we're going to learn so much from that group. The group is fantastic. It's a chocolate chip. If your anti-Mullerian is 0.08, is there a chance of using biologic eggs? Very low. It's very low because all that is a gas gauge and it's reading empty. But it doesn't mean there isn't one egg in there. So it's low, but it doesn't mean it's 0. I'm so torn between fresh and frozen. I'm sorry about that there's an internet, to be honest with you, because it drives you guys crazy as to what to do. Ask your doctor. I think that's what you should do. Hello, people joining. I'm going to be closing down here in about 10 minutes. So Natty and Omira's 04 and Sun Moon, hi. We start at 4 p.m. Mountain Time, which is, of course, 6 p.m. Eastern Time and 3 p.m. Pacific Time. So I do it every Tuesday, except for next Tuesday, folks. Just telling everybody, next Tuesday, I'll still be in Tennessee. Don't think I'm going to get in home in time. So, all right. Different question here. A blastocyst aneuploid, abnormal embryos. This is one of my 6. What do you think about this, doctor? I think you shouldn't transfer it. I think there's a very low chance for it to be successful, but if you want to, we will. How do you get rid of excess estrogen, Ramesh? Any specific diet to follow? Yes, a low-carb diet should help. But talk to your acupuncturist. The American Board of Oriental Reproductive Medicine certainly is a great place. ABORM.org is a great place for board-certified reproductive endocrinology trained acupuncturists. Healing Arts Centers at the CNY facility is a great place to get information like that. If you're here in Colorado, East Winds Acupuncture is, of course, in Colorado Springs is our group that we use here. What is the reason behind later mature after retrieval? Don't know what the question is. Do you recommend keto or Dr. Kill's carnivore keto? I don't recommend either. I recommend the low-carb, moderate protein, high-fat diet, which is actually what Dr. Kill's diet is. It doesn't have to be meat. It can be chicken and fish and eggs and cottage cheese. I live in Tennessee, not far from Chattanooga. Oh, okay. Hope you have a good visit. Give me some ideas of what to do in Chattanooga. I know they do whiskey tasting, so I'm going to try that. Age 40 is an AMH of 2.56. Good? No, it's great. Leanders, welcome aboard. Hello. Just Be Kimmy. Hello. Welcome aboard. You guys who just joined, I start at 4 p.m. Mountain Time. So if you're just joining, I only have a few minutes left. So if you want to see me on Tuesdays, it's wherever you live, figure out starting at 4 o'clock. Andrea, I was given dexamethasone for 10 days. Would you explain how this will help with my IVF? Yes, it's a very, very, very small, very old, very little study that said that adding dexamethasone and antibiotics helps IVF outcomes. 40 years ago, I think that study came out. That's why we do it. We think it'll help. We had a retrieval. We had 4 eggs mature in the second day. On the second day, why is this? I'm not sure the question. Is going gluten-free and dairy-free ideal for PCOS? I've been told that, yes. Bed rest after transfer, just that night, and then you can move around the next day. So I usually say rest that day, rest the next day. Do you recommend Valium for transfer? I do. It's a smooth muscle relaxant, and we're putting a structure called the catheter inside the uterus, and we don't want it to cramp because it can spit out the embryo. So yeah, I do recommend Valium. Do I prefer day 3 or day 5 fresh? If you're over 40, a day 3 is fine. If you're in your 20s, a day 5 is better. Would you recommend a lap for stage 1 to endo post-retrieval before transfer? Yes. Yes, I would. Thanks for my comments about protein sources. Absolutely. The goal is for consistency and simplicity. That's what the Kills Keto is, consistency and simplicity. It's a way to get folks to change the way they think, but it's not a gospel. It's just a way to think. But as a nutritional biochemist, which is what I am, that's what my PhD is, and it's really about understanding the macromolecules and how they impact your nutrition and how they impact your physiology and how they impact that. So that's what he's really trying to say. Who is the doctor in Syracuse office? Well, there's many. There's 5. Does PGS, and all you have to do is go to the website and it's got their pretty pictures. Click on the Syracuse office and all their pretty pictures will come. Does PGS testing impact the embryo? Absolutely. It can reduce the chance of success. It can destroy the embryo, but the chance of success is so much better when you do PGS testing, meaning to pick out the right embryo. So the loss rate is extremely low, but it has a loss rate. April, my pleasure. What does it mean when LH surges before starting progesterone in an FET cycle? Not very much. Honestly, not very much. It means your body is trying to break through the estrogen. That's really all it's trying to do, because it's picking up the estrogen, which is a trigger for LH, but who cares? As long as you don't have follicles that can ovulate, who cares? It just doesn't matter. Does smoking weed really impact fertility? Absolutely. Absolutely. It also feminizes the man, gives him man boobs or moobs. Not a good plan. It's really not a good plan. Not for fertility. Mrs. Kelbell, hello. Good to see you. But unfortunately, Mrs. Kelbell, I'm almost done here. So you came a little bit late. I start at 4 p.m., not 5 p.m., 4 p.m. Mountain Time. How many cycles of Clomid would you do on a woman trying to conceive but going to another medicine? Well, 3. Then take a break for a month, do another 3, and then you're done for life. It's not going to work. If you do more than 3 in a row, the problem is you can create, it becomes a birth control pill. That kind of sucks. Can I come to Syracuse for my transfer? Sure. Just call up Dr. Kills, tell him to send his jet to come pick me up. I'll do the transfer and then he flies me back home. Sure. Just tell Dr. Kills you want me to fly out here. Send his jet. Eleanor, is double trigger effective? Can you talk about that next time? Yes, I've talked about single trigger, double trigger, dual trigger, dual trigger. The whole idea behind it is using 2 different mechanisms, Eleanor, to get the body to mature the egg. There's 3. There's Lupron, there's HCG, and Kiss peptide. Kiss peptide is not available locally. So Lupron is one way of doing it in an antagonist cycle, plus HCG is another way of doing it in every cycle. How does TSH level have to be, how low does TSH level be to do a retrieval? Doesn't matter, Sierra, in the retrieval, it matters in the transfer. You want the TSH level to be around 2. What are the chances of a successful natural IVF if you're over 33 and had both fallopian tubes removed? It has nothing to do with the fallopian tube, Masuraga lips. It has to do with the your age. And so at 33, it's about a 30% chance. 5cc normal versus 5AA low-level mosaic, normal. Always go normal, always go normal, always go normal, always go normal, always go normal. If you have a normal, that's going to make a baby. If you have a mosaic, it might make a baby. If you have an abnormal, extremely low chance it's going to make a baby. Can Omnitrope help with egg quality? Yes. How long should I be on it before egg writable? I think you mean retrieval. At least a month. What should estrogen progesterone levels be on the day of a modified natural transfer? Progesterone 10 at least, 20 is better. Estrogen 100 at least. Who's ever joining now, the Taquito family and B. Hilliard, just about to end the live. I start at 4 p.m., not 5 p.m. A lot of people, I don't know why they get that mixed up, but it's 4 p.m. Mountain Time. So if you have questions, quick, ask the questions. How successful is first-time IVF for someone that has had a previous normal pregnancy but doing IVF for tubal ligation? Jasmine, you have to tell me your age, your AMH, your husband's sperm. You have to tell me your past medical history. You have to tell me what habits, alcohol, tobacco, drugs. You have to tell me if you're nutritionally sound. You have to tell me your weight, your height, your BMI. Then I can give you your chances. It's not just, and by the way, it is good that you've been successful in the past, but it doesn't, all those other factors are really important. Low ovarian reserve, first cycle, low dose, 2 follicles, egg retrieved. Second cycle did priming, higher dose, and only 1 follicle, so converted to an IUI. What should I expect? My diminished ovarian reserve, about the same. Do you recommend acupuncture or any multivitamins for someone using donor eggs? Yes. The CMAP protocol, the Credenda-Magarelli acupuncture protocol, is for anyone receiving an embryo. How successful is IVF? If all results came back good, just doing the same as a result, had 2 ectopic pregnancies, you have to tell me your age. Dr. Magarelli, I got 45 eggs yesterday, 30 matured, 20 fertilized. Oh my God. Victoria, good for you. I'm so happy for you. Andrea, I'm watching you live on the sides of the follicles to be triggered. I had a much better results with follicles 20 to 22. What do you think about that? 45 years old. I think that for you, if that works, fantastic. Ashwald, my pleasure. You're 33. Your chance of success at age 33 is about 30% of achieving a pregnancy if everything else is okay. I was prescribed metformin to keep me from getting OHS. Not metformin does not keep you from getting OHSS. You're having stomach issues, Rose, because you're eating too much sugar, and sugar and metformin don't mix. So if you're eating high carbs, stop the carbs or stop the metformin. You take bromocriptine or cabergoline for OHSS, not metformin. Amanda Rivera, hi. Hello, Dr. Mag. If someone has PCOS and they are doing IVF, should they be on metformin? It's not a should. It's not a should. It's just some doctors like it. I tend not to use it anymore. Used to, not anymore. It's hard on the liver. I think a low carb, moderate protein, high fat diet will be much better in the long run for you, your baby, the next generation, and your grandchildren. That's what I think. Hello, Norm Matalia. Welcome aboard. Crazy Sassy. I'm 36 with diminished ovarian reserve. You have to give me more. I forgot what your question was, Crazy Sassy. I'm actually on a low carb. Perfect. Then if you're getting upset with stomach issues, talk to the doc. I'm not sure, but I'm on a 1 a day and have to get up to 3 a day. I know it's not low enough, Rose. Start looking at your carbs, okay? What do you recommend a 3cc embryo to go to PGTA? Would you recommend a 3cc embryo? Well, if you only have 1 embryo, I would put it in. Does AMH change? It goes down. That's all it does, is go down. Because it's a marker of ovarian reserve, and if you're less than 35, you're losing 1,000 eggs a month. If you're over 35, you're losing 10,000 eggs a month, and if you're over 40, 15 to 20,000 eggs a month. So every month, your AMH should go down. First time IVF due to tubal ligation. How successful is IVF? You got to tell me, Jasmine, how old you are, because that tells me your chances. Dane Quill Lofters, if you just joined, I'm just about to sign. Actually, I am signing off here, so I start at 4 p.m. So Jasmine, you're 40 years young, tubal ligation. First time, it's about a 10 or about a 5% chance of success if you're using untested embryos, and about a 40% chance if you're using tested embryos and they're normal. I sent the question above. I am a healthy hubby. Sperm was good, but he does have low sperm. Yes. What's the question, though? Is Vitex a good supplement to take? Not sure. Just had a frozen embryo transfer 8 days. So I don't know what that means. Hashimoto's at age 29. Make sure you're on treatment, Amy. All right. Well, I'm Dr. Magarelli, CNY Fertility, Colorado. Thank you for joining me. It's Tuesday. We talked about, go back and let me see if I can pull that back up here. Let me get out of this. Go to next. All righty. Let me go back up here. So we did a talk. I'm going to bring it up for you guys. I'll stay a little bit extra here. So we did a talk today on natural cycle frozen embryo transfers. And our takeaway lessons were Higher pregnancy rates with natural cycles, that you can use progesterone. You don't have to use estrogen. That in a natural cycle, you have less a chance of preeclampsia or hypertension. In a natural cycle, you have a clinical pregnancy rate that's 63%, not 53%. I need to change that. That's 63%. Put a 6 in there. And so that's good. And a live birth rate of 50%. So almost 10% better live birth rate, lower miscarriage rate. So definitely doing an unmedicated cycle is a good thing, not a bad thing. So that's good for us all to know. That there are, that even for, there's a benefit physiologically from having a corpus luteum. So that's another good thing to know. And bottom line is you could do either one. At CNY, we do both. There's some support for them. Questionable data to use the HCG support for natural cycles. And even for frozen embryo cycles, there's really not a good reason. So anyway, folks, with that, I thank you for your kind attention. I will see you guys in 2 weeks. I will see you guys in 2 weeks because I'm going to be gone next Tuesday, sorry. Think of some questions. It'll be a Q&A. And thanks for joining me. And I wish you a pregnant journey. This is Dr. Paul Magarelli, CNY Fertility, Colorado.